Today, we've brought back Karen and Joanne to talk about one of the most pressing issues in the entire industry, really. It's the whole cornerstone of why we have a cannabis industry in the first place, but it seems to have been neglected over the last couple of years. And so we have the wonderful Joanne Griffiths and the wonderful Karen Gray of the Intractable Charity. And I'll let you guys introduce yourselves and say a little bit about what the charity is, and then we'll get a little bit into your backstory about some of the trials and tribulations you've been through and all of your incredible efforts at the moment to support families across the country. So maybe Karen, if you want to go first, as you were first in the call today.
Yeah, okay. So I'm Karen Gray, and I got into cannabis because of my son, because he needed it. He was having lots of seizures, really ill in hospital. I did a lot of campaigning. I started a petition to get it, legal on the NHS. Yeah, I travelled to Holland to get, to basically smuggle this oil in for him because we couldn't access it here. We couldn't get any help from doctors. It was absolutely horrendous. But I persisted, went ahead, got the oil, gave him it, and he went seizure free quite quickly. He's not had a seizure in 6 years, and I weaned him off the cannabis oil last year, which is incredible and amazing.
And you were just talking about taking him up a mountain
yes,
in the not too distant future as well, Karen.
yes,
So
yep. Every weekend we've been doing lots of things that we just wouldn't have been able to do. I mean, we went to an island at the weekend. We wouldn't have been able to do that. Imagine if he'd had a seizure. We just, things like that were impossible. And it's amazing that we're able to do this now. And it is all thanks to the cannabis. The syndrome he's got, he can grow out of it. 50% of kids grow out of it. But we didn't think that was going to happen by the way it started. He started off having really big seizures, and the percentage of kids that start off that way will always have seizures, but not Murray. So the only thing to explain there is the cannabis oil. We watched it. We stopped giving them THC. We watched the seizures come back. We started giving it again, and they went away. And I do think that the cannabis oil is definitely attributed to how well he is now. Joanne, obviously, tell you about like the charity and everything like that. So yeah.
Yeah, I'm Joanne Griffiths, and my son is Ben Griffiths, and we got into this because of our son as well, because he's got intractable epilepsy. He's having over 100 seizures a day, and now he is either seizure free or he has 1 or 2 a day. That's it. But then the severity of them as well is much reduced. During COVID, we saw so many children, coming off their medicine because the parents couldn't afford it. So we decided to set up a charity so that there was an emergency fund in place for these parents in case they really couldn't afford this. And we could get that, keep that continuity to the children and preserve their life, basically. And so that's what the charity is predominantly there for, is for the preservation of life for those that suffer with severe refractory epilepsy. But also, as part of our charitable objectives, is that we can also partake in research. And that's where we contacted you, Chris, and you came on board with the charity. So I think you can explain that side of things as well.
Beautiful introduction, both. And I think maybe one of the best places to start that we've sort of semi-alluded to is that transformation that you've seen in Murray's health and Ben's health, and that a lot of other parents are seeing as well. What seems to be, the biggest challenge, in addition to the epilepsy and having a child that's suffering from a chronic health condition, the financial element that you touched on there, Joanne, and the whole reason for developing the charity in the first place. Can you tell me a bit more about what you've both been through? Maybe Joanne and Karen, for example, going overseas to try and access these medicines, some of the doors that you've knocked on to try and make this happen, get access, and that you've been on over the last couple of years to try and sort of fight the tide to get access to these medicines for the kids.
Yeah, well, in 2018, early on, So we had a friend that gave us medical cannabis from Canada. It was a 1-to-1 oil, but it reduced Ben's seizures to just 6 a day. And we couldn't increase it beyond that because the THC content in it was a little bit too high. So we asked our MP about, because there was campaigns going on at the time, if we could also have a license. This was in around March 2018. And we were told that there'd be a route for our child to obtain it. We did all the government access forms. So we tried to do everything very legally and above board from there in out. And we asked basically for us to be able to obtain Ben's medicine that was helping him. Basically the medical director, the doctor was, you know, our NHS neurologist was very supportive. He filled out all the access forms. The medical director said he just wanted some policies in place because it was still a Schedule 1 drug at that time. You know, where would they keep it, things like that, which we agreed to. And then he retired and it never happened. And we were kind of then, when we ran out and Ben was having, you know, hundreds of seizures again, and some of them were over 20 minutes long, we were then sort of told we could have access to Epidiolex. So an application for Epidiolex went in, which we were happy to do because at the time, because our son had deteriorated so much and we just wanted something that would help him. And it seemed that was the only way forward, because they said, oh, you know, the government panel will be disbanded. So it was a case that we had to just go with it and try Epidiolex, which is what we did. When quite quickly, within a week, he suffered allergic reaction to the Epidiolex, had severe vomiting, diarrhea, and eventually ketosis. So we ended up asking for full extract, and that's when things became very difficult for us as a family to communicate with the doctors, because the management was called, the discharge letter for our son was that it was illegal to prescribe THC. And that they couldn't give us these illegal drugs, and actually it wasn't the case at all, because there's 2 children that have been prescribed this since 2018, the exact same medicine basically on the NHS. So we continued to battle and fight this, and as we got into the realms of private healthcare, we went to the Portland Street. So we went to just see a doctor because Ben's condition was so poor. He couldn't eat, he couldn't drink. He was deteriorating very quickly. Basically, they gave us the prescription, but it was, by the time, it took about a month for them to get that onto their system and to find out, well, what is this going to cost? And at the time, it was £550 per bottle, 10 ml bottle of Bedrolite. And I think it was around £220 for a 10 ml bottle of the THC, which was the Bedica.
So how many bottles was he requiring then in total, Joanne?
It was
like the cost.
So for the very beginning, it was 2 bottles of the Bedrolite and 1 bottle of the Bedica, which was the THC, because you're microdosing that. You're only giving very minute amounts. But, you know, that soon escalates. So when you look at this, as we sort of increase the dose, a full sort of dose for Ben is 12 bottles of Bedrolite, of the 10 ml Bedrolite. So that's a huge cost. You know, it was getting into the realms of £6,400, you know, pounds a month. We couldn't afford it, so we asked again for the government license. We received a letter from the policing minister to say, no, there's a process now. You have to use the importer that was charging the pharmacy £340 odd pounds. And then, you know, we got an importer step up eventually after Karen and another mum did a a documentary. So I let Karen talk about that and how that progressed then.
Yeah, we were really, really lucky. Me and another mum whose kid needs the oil as well and still does in Scotland. We went to Holland and thought, we're going to find a doctor and we're going to get a legal prescription for this oil that 2 kids in the United Kingdom are actually getting free of charge on the NHS. So we did. We went for 4 days. We found a doctor. We did a BBC documentary as well. We took him with us to film it all, thinking that it would showcase how difficult it is to get this, to access it, and how it would maybe help change things, which unfortunately it didn't. But we did this documentary, and luckily an importer was watching it and contacted the other mum and offered to help the boys by bringing in the oil, which was just amazing. And so that's how that started. However, they were still charging the same price. So it was still costing over £150 for a bottle of Bedrolite. And as Joe said, Ben's on many bottles. Murray was on 7 bottles a month. And just ridiculous. How are you supposed to find that kind of money? And when you can see it helping your child and stopping these seizures, you're going to find that money because you've not got a choice. You're not going to just let your child have a seizure when you know that your child doesn't have to have a seizure. But it's just absolutely ridiculous that so many years on, no kids have been helped. We've got an industry making loads of money.
Yeah, so for us, we sort of went from in the June asking, getting this letter to say, no, you can't. And then I went to see my MP who said, well, just go and bring it back, basically. Other children, other parents are doing that and then they're given it back. So it was a case of just go over abroad, get a doctor there as well in case. And so we had 2 doctors and just in case. So we tried to, mitigate every sort of legal, objection to us bringing it through. And then we just did it. We just did it and brought it through. But at the first time that I did it, I actually was stood in the pharmacy and one of the other parents came up and said, don't give her all of the oil.
In Holland. Another British parent going over to smuggle their oil.
So they were going back to a different airport to me. And as I landed, I got all of these messages saying that they'd actually been pulled and they'd had their medicines confiscated. And that was terrifying for me, to then walk through. I mean, luckily somebody was quite drunk and, I think they'd had, I don't know what they'd had, but they were causing a kerfuffle so that the heat was sort of took off me and I just walked through. But it was terrifying. It was really terrifying because I'm quite a law-abiding citizen. I don't really do anything, that I've never had to. And I had to do anything illegal or,
it's the stress of standing in that line when you're coming back into the UK with all these bottles in your hand luggage and you're getting closer and closer and closer. And you can see the guy standing from the what do you call it?
The check-in desks.
Those guys, right? You're actually sweating and you're thinking, the shoe advert, the spray advert that stops you sweating, and you're just standing there thinking of that, thinking, oh my God, they're going to know, like, I'm carrying something dodgy here. But I was going through, and I always, when I was bringing it, thought, if I do get pulled, they're not getting it. They're going to have to physically take it off me because that's my son's medicine and he needs that to stop seizures. And I'm not having somebody coming up to me and taking it off me. They can get lost. They're not getting it. Luckily, and that never happened. Thank God.
Yeah.
But still, it's very stressful.
It's not just that. It's that you've fundraised to raise all of this money because you go and get 3 months at a time. So it cost you around £4,000 because it was a third of the price. So a bottle over there at the time was €168 versus £550 in the UK. So
ridiculous.
it was a no-brainer. We had to do it, but because you were going and getting such a large amount, it was more sort of the stress of having to try and find that money again. If they were to confiscate it, that's like £4,000 gone. How are you supposed to raise that again and ensure that your child's well if it wasn't given back? You know, we did fundraisers. Our local spa donated £1,000 to the kitty. We just did all sorts. We borrowed money off family. A lovely singer, Connor Banks, locally, he did an amazing, event for Ben. And at any sort of events that he did, he used to put like a little tub out so that we could fundraise. We fundraised through a company that basically kept hold of the funds at first because we were paying for them here in the UK. And when we said to this charity, could we go abroad and get it and then pay the pharmacy abroad? They said no, because they'd been complicit in an illegal act. So we then had to quickly start trying to just get monies and cash from anywhere. And there was basically a children that fundraised for other children called Kids for Kids. And they put on a big show and raised funds for Ben. And we were able to then obviously get them into our own bank so we could go over and get the medicines from abroad and bring it back. And realistically, should we have had to do that after the law was changed? No, because there's 3 children that are quite happily getting their medicine every month. Funded.
And 2 of them are getting the very same medicine, like the very same. Explain that. How are they getting that paid for them through the NHS? And like Ben's not, Murray wasn't, the other kids aren't. It's absolutely shocking, and it's really bad. Like, it's really bad.
So now, having been through that, and I'm trying to get to the foundation of the charity, when did you start seeing more and more parents coming to you? And then as well, you've had lots of discussions with different journalists, BBC, all the newspapers, you've been to all the government departments. What have you found along that way? But also what I want to sort of hear about is like the other families that are going through this too. Like, if you had to estimate, like, you guys are the tippitiest tip of the iceberg of what's out there and other families that are going through that and going through that same journey too. So what role does the charity play? And then also, how has this been happening and people haven't solved the problem yet? Let's say, like, you've had all the journalists, you've had all the documentaries, you've had all the discussions, but
yeah, we've had loads of people look into this, right? I've even had an MP saying to me, I don't know what's going on here. Like, we're not even getting answered. So, and I'm getting infuriated. So God knows how you must feel, because we can't even sort this out and solve it. We don't know, like, where the blocks are.
Me personally, I think the blocks are within the NHS. I don't think there's the funding isn't there. So when people doctors want to prescribe these medicines, they go to the IFR, which is an individual funding request for their patient, which is difficult in itself because there's different IFRs and they've got to navigate that, and often it's difficult for them as well, because it's not something they'd probably do every single day. So we have got quite a sympathy with them as well, because some doctors within the NHS really do want to prescribe this and have tried to help the families, and they're then being prevented themselves by their management or through the IFR processes. And the IFR, I mean, these panels are made up of GPs and lay people and all sorts of different they're not specialists that understand this medicine. They don't understand how it works. And I feel that you've got a specialist there, and because only specialists can prescribe in the UK. So you've got a specialist doctor who's a neurologist that wants to prescribe this medicine, and then they're being prevented by a panel of people that aren't an expert, that don't understand actually how this person's, in their view, you know, in the doctor's view, is materially different. It's quite shocking, really. And my personal experience was that we jumped through all the hoops. We did the IFR, and we did it for years, and that my son's case was disseminated across all CCGs, now ICBs, to prevent other cases basically in the future that were similar. Well, they should be, you know, there was obviously the talk about us being part of a campaign, and also the fact in there was email transfers to say that the issue isn't that this is an unlicensed medicine, because they prescribe, you know, they fund unlicensed medicines every single day and prescribe them. The issue is that it's THC. And that shows the stigma actually within the system in itself. So is anyone getting this? No, nobody's been successful for epilepsy. Some have been successful through the palliative care system, you know, but realistically, it is for the seizures.
Yeah. So, two things I want to try and touch upon that you've mentioned there, Joanne, are that sort of frustration of what you were promised versus now. And Karen, we talked a little bit about this pre-recording. What do you feel has been unfair about it? And that's for you, Karen.
We were promised that those with chronic conditions, intractable conditions, and when it was given to the 3 children, it was, they said, you know, we're giving it to these 3 children, but they said also that they said other parents as well that are campaigning for this, and other children. Those are the children at the time, my child being one of them, from 2018, asking for licenses and whatever else, have been denied access quite categorically. We're just being denied access through the systems in place. We've jumped through every hoop, and you know, the bureaucratic hoops, as we say, are just that, you know, that they're just designed to keep us going round in a hoop. That's why we call it a hoop, because we're just going round in circles. Nobody's sitting down. Now, the previous government in 2020, prior to COVID, said that they would sit down and within weeks get everyone around the table and sort this mess out, because they understood that there were blocks in place. And that's never been done. We were also promised an observational trial that came out of, in 2019, the Health Select Committee. And we were promised observational trials for our children that are already accessing, because they can't access the trial that's about to happen for other children, because they're already on a product. They'd have to try and wash it out of their system, which is unethical to do so, because these children are quite poorly, as Karen said, when Murray didn't have his THC medicine. He ended up having more seizures, and they had to put it back in place quite quickly.
Had to go back to hospital.
Yeah. So,
but we walked out. Murray walked out of hospital due to THC. Even the neurologist couldn't believe it.
And actually, that happened to us in 2023 when there was a supply issue due to a prescription error, because there's very strict regulations around the prescribing of medical cannabis, and one of them is that you can't do electronic prescribing. Now, you can for other drugs that are, you know, equally, you know, have a harm, that what they call, you know, they put in this category as special medicines, and the strict protocols around prescribing. Now, if phenobarbital, clobazam, things like that have a street value as well, and they are prescribed by the GP. They're sent across to the pharmacy electronically for you to go and pick up. They are specials. So my child's phenobarbital is it's specially mixed up into a medicine for him. And the GP can prescribe that. He can just send that across to the pharmacy and we can go and pick it up. But for medical cannabis, what you have to do is you've got to write a physical prescription, and that has to be sent to the pharmacist. And when the pharmacist receives that, that's when they can dispense it. So if there's an error in the postal service, as we know, post goes missing all the time, it's delayed, then you're not getting your medicine, and it's a big issue, and it's one that the government isn't moving on. They're not changing things for patients to ensure the safety. And my son ran out of his medicine on a bank holiday weekend. The clinic was shut. The pharmacy was still open in Scotland, but they couldn't dispense it without that physical prescription. The NHS paediatrician wanted to prescribe it, but was later told they couldn't. And my son was sent home and subsequently blue lighted back to hospital less than 24 hours later into resus with very low oxygen levels of 72% with a full oxygen mask on, and having back-to-back seizures. It was quite horrific. It was horrific for us to watch. His carers had never seen that before. They were on the floor crying. That's how severe it was. And we had to, manage that. We had to get another child's medicine and administer it, and he was able to walk out. That's, to me, is wrong. I think there's things need to be changed to ensure patient safety, and the government just are not engaging with patient groups at all.
Yeah.
To be able to start really looking at these things and saying, this is why we feel like this. This is what's happening to patients, and it's actually putting patients at risk. And it is, really, somebody could die because you just can't put this system in place for the private sector.
Mm-hmm. And even obviously the government should just legalise it because they know it's medicinal, it's a medicinal benefit, just legalise it. However, that's not going to help the children if it gets legalised. They need medicine and they need it funded.
Mm.
We want it. I think it should be legal. I personally think it should be completely legal, but it won't help the kids. We need to do something to help the kids to get it.
Yeah, I think if you're on a lot of different medicines, like the children are, and that obviously their condition, they can die basically if they have a particularly nasty seizure, they could die. So it does need to be managed by a doctor for them. I think you've got to manage the interactions and everything else, and because there are interactions, as Chris, there's interactions with other medicines with medical cannabis, and we've really got to start looking at that properly, and as patient groups as well.
So my question for you now is, how many other families do you think this affects? But also, what's it been like having so many people come to you guys for that advice and guidance as well, who are also going through those challenges? What can you give people an idea of what and who else this affects, and how many people this affects behind the scenes that haven't been able to speak out and haven't got a voice?
So from a charity point of view, there's around 50 children prescribed medical cannabis privately. That's because there are no doctors. There's 2, I think, prescribing currently. The other doctors have retired, so we don't have as many private doctors prescribing this as we would like. There's a whole lot of children now that are going to the black market to obtain these medicines.
And they're the lucky ones, Jo, aren't they? Because we've seen children where the parents are too scared. They're too scared to go to black market. They're too scared to even go to Holland and get a legal prescription, right? Because you obviously can't get one in the UK. And we're seeing these children just having seizures and not having any quality life. And it is actually heartbreaking watching this, knowing that if they just got this oil, that child would have less seizures. They would have a better quality of life. It's heartbreaking.
Yeah, they'd have a chance of, you know, of seeing if it works, because obviously we know it doesn't work for everyone and there's different preparations. And just because one preparation doesn't work, it doesn't mean that you shouldn't try a different cannabis.
There's so many strains, yeah. So many like ratios that, you know, everybody's different, eh, Joe?
Yeah.
Yeah, and it's the same with epilepsy medicines. You know, you could have 10 people in the room that have the same condition, and the medicine prescribed might work for 2. You know, it's that kind of situation. It's very personalized for epilepsy, and I think that's where people aren't really very understanding. The medical profession isn't very understanding, because they want to try and write a textbook for doctors, but it just doesn't really work for epilepsy in that way at all. I think there's some things that are a textbook, and then there's other things that just aren't. And I think the medicine side of it and the treatments are personal to the individual.
Absolutely. Like, because some kids can take the oil 2 times a day. Some kids are taking it 4 times a day. You know, some kids are getting more THC than other kids. And it is all so personal. It's about just dosing it up and stopping whenever you get to a therapeutic level.
And there's around 34,000 people in the UK that suffer from intractable epilepsy. They make up around sort of 34% of the cohort. So we've got, you know, a number of people out there that could possibly be helped with a medical cannabis product, you know, that's on the market somewhere. They could try different ones, but until there's a wide range of products within the NHS and readily being prescribed to, you know, families, then we'll never know. Well, then those people will never know whether the condition could be helped, you know. But the other side of this is, within that cohort, is that there's some that are sort of suffering daily or weekly, and then there's others that might have a seizure a month, you know, once a month. And then we know that there's some within the cohort that have tried, you know, all the medicines, you know, that there is available on the NHS. And then there's others that have only tried the 2 and say the side effects are so severe they just don't want to try any others. So we're in that position really where nobody's actually broken down the actual intractable epilepsy cohort, which is something that we've been looking into trying to do. And we've been discussing this with many different people, charities, and also the BPNA. When we've gone to their meetings, we also just discussed it with Finborough Callaghan to try and create a registry on intractable epilepsy, because there just doesn't appear to be one.
So jumping to right now, you've been fundraising, you've got the support of numerous businesses, you've had all the media coverage in the world, but what I think maybe would be great for people to hear is how they can support yourselves and the charity, either through fundraising, raising awareness, pledging, donating. What sort of impact would that have on people's lives? How many families could potentially be supported? And how much of that stress that those parents are going through, how much good could come from that if people were to get engaged?
See if you could actually guarantee the parents, you know, if you get the soil, we will fund it. They will get it, and their child will be helped. It's as simple as that.
I think how people can help is go on to End Our Pain, support our charity, but also, you know, Intractable Epilepsy Charity, but also support the campaign by sharing posts, by writing to your MP, and supporting our initiatives. And realistically, all of the families need to come together. You know, we need to come together on this, and, you know, all be in Parliament saying that this just isn't working for us. It's
not good enough.
Rolled out. There's obviously clear blockages in place, and the government really needs to step in now, because this has been going on for nearly 7 years, and it can't continue because families are now going to the black market. It's not acceptable.
And yeah, the law was changed for the children. I mean, that is actually why the law was changed, to allow clinicians to prescribe cannabis for the children. For the children that are still not getting help.
And
that's what I want to touch on, Karen, is that exact point, is that there's tens of thousands of patients who don't have life-threatening, imminent death sort of scenarios with seizures. Why can't we do it for this cohort where it is life and death, who really need the medicine most and really need that care and support? And I think that's some of the discrepancy that's there that isn't really being addressed. You were promised that the law change would resolve your issue, but it hasn't. And almost the wrong audience, but a wider audience is being served, and not that original sort of group who were suffering the health inequality in the first place. You've still got the burden of the bills and don't have any of the support. Meanwhile, the industry's now sort of opened up and everyone's trading, raising great money, doing great businesses. But I think what we're getting to is that now's the time to come back and help those parents and those families that are in the most need, that aren't getting any of the support and were responsible for a lot of the law change in the first place.
Yeah, the clinics wouldn't be operating if it wasn't for families such as us campaigning to get it legal. And that's a fact. That's the truth, and it's the truth, and it's a fact. So can they just sort of help the children, because they wouldn't be in business without the families of these children. You know, it's good that they are, don't get me wrong, it's brilliant, but it's not fair on the children, and people need to be aware of that, aware of why the law was changed and the fact that the children haven't been helped.
And I think the media could really help us as well, because, you know, they put families out there at the forefront of campaigns to have this legalised, but they're not really putting it out there as, you know, like they were putting it as front page news.
Yeah.
There's the front page news that this isn't being rolled out for all of the families that the government said they would help. So what, you know, they've not sort of said, well, who can obtain this? There's no clear guidance in place. This is why families are going round and round in circles. And I think that it's time that the government stepped in. We've got a new government now. They could look at the whole picture here and really help and change certain policies that just aren't working. We know it's not working because nobody's getting it on the NHS.
So at the moment, I want to ask you both about some of the fundraising that you're doing, and maybe how other people can get involved, as well as supporting the campaign online. How are you fundraising at the moment to maybe give some businesses and some industry professionals some guidance on what you're doing, and maybe they can see how they can help support some of that fundraising and awareness raising initiative?
Do you want me to?
You go over it, the Great North Run.
So I do all the Great North Run stuff. So we've got that coming up in September again. This will be the third time I think we've done it. It's a fantastic experience, you know, for the people that are doing it. We've got 5 great blokes that are going to run for this and run for our charity. I mean, maybe support them. We'll start sharing some of those things, but also we have the Couch to 5K, for instance, if you're trying to, you know, get fit for the summer, you know, or you just want to get fit, you know, there's the Couch to 5K challenge. So if you're doing it for a charitable cause, you know, you're more likely to continue and do it. What else do we have?
We've done fundraising walks, like me and Joanne and the 2 boys have actually done fundraising walks as well to raise money. We've had a guy that's actually a painter that painted a lovely picture and raffled it off for us that raised money for the charity, which went to, you know, to basically pay for a child's cannabis oil. Yeah, lots of really good people. We've had a runner, some of the people running for us to raise money. It's amazing, really good. really helps.
Realistically, if you wanted to do anything, we're on Just Giving, we're on, you know, other fundraising platforms as well. Have a look on our website and see, you know, what there is out there. It's intractable.org.uk. So you know, if you want to do something, you know, a bit different, you want to jump out of a plane, for instance, you know, get on there, create a page, and, you know, do it. Yeah, raise some funds for us, because, you know, it is a really good cause. There are people that have run out and ended up in intensive care, you know, so we want to prevent that from happening to children and ensure that they've got continuity to their medicine.
Mm-hmm.
As
Definitely.
well as looking at research, so that, you know, we can open this up for other people. And, you know, we also go to the campaigning events to make people aware of us and make the MPs aware of us, that, you know, we are a charity and we are needed, basically, and we shouldn't be needed for those.
Mm-hmm. Yeah.
Well, thank you very much, guys. I'm going to say, if you're a business, if you're in the industry as a professional, if you're somewhat affected by this in some way or feel as though this is a good cause that you can get behind, there's lots of great tax incentives to support charities and get involved and put some of that money that would otherwise be going to the tax man to good use to support wonderful charities such as Intractable. And if you do want to get sponsorship, if you want to help raise money and work alongside us to try and make sure that this campaign's at the forefront of the political checklist, so to speak, we're always appreciative of any guidance, support, and Joanne and Karen are two of the loveliest people you could possibly want to work with. So keep up the great work, both. Thank you as well for everything that you've done over the years. Yeah, no. You've helped hundreds of people, thousands of people with sharing your stories. So big hats off to you both. And also, yeah, thank you for all the lovely work you do. And if you're watching, come and get involved and get and share with them, join in and do your bit. So yeah, nice one, ladies. Thank you.
Thank you.
Can I just say, so my son, wonderful support worker, who is a fantastic artist, who used to work for major big companies doing their artwork, you know, M&S and people like that. She did some drawings of Ben and some friends and different things. So we were, because I said, oh, I'd love to do some sort of educational stuff actually based at the children, because these children are taking these medicines, and how do they navigate the stigma that might be attached to their medicine, you know, because it's a new thing being rolled out, you know. So we want to do some promotional things aimed at the children. We wanted some characters, and she drew them. And that was way back when the charity was first formed when we first got charitable status in 2022, and we've never really done anything with them. So we are now looking to do something with them and put out some information based at children as well, so that they can start learning about their own medicine, and that children as well, you know, often they want to be involved, especially if they're, you know, they have the ability to do so. They want to be involved in the decision making of their treatment. So I think it helps them to understand that all the treatments available out there. Also, we'd love, I'd love people to get involved in maybe trying to name the characters as well.
Oh.
Yeah, I mean, if some of the businesses could come forward. I think I put a post out on LinkedIn about doing this on my personal page, Joanne Griffiths. So if they want to have a little go at naming some of these characters, maybe using some of the strains and different things, I think it's quite a fun thing to do.
So if you do want to get involved, all of the information for Joanne and Karen will be in the description of the video, where you can interact with them, connect with them, ask them questions, and then also all of the latest campaigns and initiatives they're going to be working on will be in there too, so you can get involved. So thank you very much for listening, and we'll see you soon.
See you soon.
Thank you.
Thanks.
Nice. Candid.
Good. Brilliant.